Yeah, well, I mean, I think probably one of the real dangers of measuring value, I guess inelegantly or perhaps incorrectly, is just insufficient risk adjustment. Now, risk adjustment's never going to be perfect. It just never will be perfect, and at the end of the day, we have to try to measure value. But if the risk adjustment is wildly imperfect, and that can lead to patient selection and also sometimes provider selection. For example, we know from prior episodes in New York and Pennsylvania in the early 90s when mortality rates were reported on that were not sufficiently risk adjusted, that led to a lot of patient selection. So patients, and this was demonstrated by David Dranov, an economist, patients who were sicker, but they were providers were selecting patients who were healthier for procedures, and those are the types of changes in behavior that you'll see if there is insufficient risk adjustment. I think the other thing that really has to be thought about and that people have to be cognizant of is just the role of statistical variation in measuring value. So Justin Dimick, health services researcher, published a paper in 2006 in JAMA where he demonstrated that on average for a hospital center to be able to detect an increase in the mortality rate, twice that of the national benchmark, that facility would need to be doing about 270 bypasses, and that's over the course of 1 year. So that's to detect an increase over the statistical margin of error. So you start breaking that down at the provider level, and pretty quickly you get within the statistical, basically within your error bars. And a lot of times when we talk about value-based care, we're talking a lot about benchmarking, comparing providers to other providers, comparing facilities to other facilities, and there really almost always needs to be some sort of error bar or some sort of measure so people are actually cognizant of what is just random variation and what isn't. Because if it's within the error bars and it's just random variation, then it's not. One can't be confident of those results, and it can lead to really sometimes very dangerous conclusions.